This portion of the presentation is the pathophysiology of a DVT. It affects 1 to 2% of the hospitalized patients, and it is a disruption of the vascular integrity of the lower limbs. Primarily the calf, thigh, or pelvis. It's a primary cause of a PE also, which is a blood clot that has been broken loose and travels to the lungs. Results in the death of approximately 200,000 patients each year in the United States. About 70% of the patients referred for clinically suspected venous thrombosis do not have diagnosis confirming, and 30% of those have the thrombosis, where 85 have a proximal, and the remainder of those 85 have confined thrombosis to the calf. Physicians cannot rely on signs and symptoms to diagnose a DVT. They must depend on imaging studies to guide the treatment, ultrasound being the preferred treatment of choice. Patients with a proximal vein thrombosis, if it's inadequately treated, 47% frequency of the recurrent venous thromboembolism within 3 months, meaning they possibly, out of 100 people, 47 can possibly have recurrent thrombi. If it is adequately treated and the anticoagulant response is achieved, then less than 2% will have a clinical reoccurrence. Right here is just a picture where this is your vein, and here's the clot blocking off circulation. Patients with symptoms of recurrent DVT can also present a difficult diagnosis. Only 20 to 30% actually have the disease. The remaining 70 to 89% have symptoms arising from chronic venous insufficiency and any causes of lower calf pain, injury, muscle injury, etc. Signs and symptoms of a DVT are included but not limited to redness, swelling, warmth to touch. This slide is basically saying that DVT and PEs can cause serious, possibly life-threatening problems if not treated, and only about half of the people who have DVTs have signs and symptoms. Here's the signs: the swelling of the leg along the vein, pain or tenderness, walking. Pain or tenderness in the leg may only be felt when standing or walking. Increased warmth to the area of pain and red or discolored skin. Some people also have no symptoms for the DVT. Conditions that are similar, as I said, are muscle injury, cellulitis, and inflammation of the veins. The prognosis, because similar conditions, there are special tests that can be performed. You've got your ultrasound. It detects the blockages or clots in the veins. D-dimer, if it's positive, there more than likely is a clot. Contrast venography, invasive, usually not used unless it's a severe special case. And you've got an MRI. It can provide the images of the clots and veins, but not used generally to diagnose the actual clot. You have treatments of orals and injectable medications. The injectables are immediate, where the oral takes a few days to get to the effective therapeutic levels. The oral medications help the clot reabsorb back into the bloodstream. You also have your IVC filters, and you can also have a thrombectomy, which is the surgical removal of a clot, which is only done in rare cases. You've got your clot busters like Coumadin. Increased risk of bleeding is also reserved for is also probable with the clot busters, so you want to talk to your doctor and make sure that you're being monitored very closely. And here's just a picture of your injections and your pills. Thank you for your time.